Heart attacks are not just for the older generation. A shocking new study reveals this disturbing trend. Young adults are increasingly suffering from fatal heart attacks. The rise is drastic, a 57% increase over 11 years. Who is hit hardest? Surprisingly, younger women. This video sheds light on a pressing health issue. Many assume heart problems won't affect those under 50. But data shows those in their 30s are at risk. Identifying the urgency gives us power to change this narrative. Let's explore the findings in detail. A recent study gathered records from nearly 1 million people. It focused on first-time heart attacks in adults under 55. Severe cases saw the most alarming increases. In-hospital deaths from these severe attacks rose significantly. More than 3/4 of heart attack patients were men. Yet, women faced higher mortality rates during these events. Women's risk for in-hospital death was notably higher. This pattern indicates a worrying trend among younger women. Historically, cardiovascular mortality has decreased for older adults. But this trend is reversing among younger individuals. In recent years, nearly half of heart attack patients were below 54. But fewer resources are reaching these younger adults. This is due to a lack of awareness and screening. Why is this trend changing? The study identified several risk factors. Diabetes rates among young adults almost doubled recently. Obesity also surged significantly within this demographic. Kidney disease, drug use, and high blood pressure are rising too. These conditions lead to a heavier cardiovascular burden. Young adults now carry risks that earlier generations did not. Almost half of adults aged 20 to 44 have at least one major risk factor. Childhood obesity is tied to this uptick in heart disease. It sets the stage for problems like insulin resistance. The impact grows silently, manifesting later in life. Millennials and Gen Z face the consequences of poor childhood diets. Women encounter unique challenges regarding heart health. Risk factors like chronic stress and under-recognition in healthcare are common. Often, women's symptoms are disregarded or mistaken for anxiety. This could lead to undiagnosed risks and higher mortality rates. COVID-19 added another layer to this crisis. The pandemic intensified heart attack risks among young adults. Research shows heart attack deaths rising, particularly in those under 45. Chronic inflammation from COVID can linger, affecting heart health later. Now, let's consider risk assessments. Traditional calculations focus on 10-year heart attack probabilities. However, they often overlook long-term risk like the 30-year model. Young adults should seek 30-year estimates for a clearer picture. This provides valuable insights into their true cardiovascular trajectory. Less recognized factors are crucial too. Lipoprotein A is an inherited risk not commonly tested. Chronic inflammation markers indicate early heart disease risks. Mental health struggles also elevate heart disease chances significantly. So, what can young adults do right now? First, they must know their health numbers precisely. Request comprehensive tests, including for LP, A, and inflammation. Second, they should always ask for both 10-year and 30-year risk assessments. Family history significantly influences individual risk. Adopt lifestyle changes. Stop smoking, exercise regularly, and maintain a healthy diet. Women must advocate for themselves. Symptoms can look different. Heart disease myths must be dismantled. This health issue is not just for older individuals. Young adults, especially women, are at increased risk. Most heart disease factors are preventable and manageable. Awareness is crucial in reversing this alarming trend. Let's not wait for symptoms, let's take action now. If this video sparked concern about your heart health, share it with someone you care about. Follow us for more insights on vital health research.